Invite. I'll be speaking to you about impact of Brolucizumab on fluid resolution in DME, real world experience. Can I have my slides, please? Yeah, thank you. So this was discussed, so I'll skip this slide that Brolucizumab was...
Can you come to cases directly?
Yes. So basically what we have is, this is just one slide I wanted to say that what I call as rebellious rebels of diabetic macular edema, they don't behave naturally. You expect the unexpected. Surely you would have seen such patients where the DME doesn't respond to your treatment and you find that you have got an orange when you look for an apple. And most important, I feel in our subset of patients, we have patients who are like rebel patients. The disease is not rebelling, but the patient is rebelling by not coming. He's a young gentleman of 40 who is working, as Gopal said, and he doesn't have time to leave his job and come. So ensuring compliance is the key in controlling the progression of irreversible loss in this. And we know that this is a multifactorial disorder. So let's jump into my cases. So this is a 75-year-old Sindhi gentleman who was totally uncontrolled diabetic with a very high HbA1c. He was a one-eyed patient. He had received some laser and some injections elsewhere. The right eye had developed foveal atrophy, and this is how he came to me in 2017. So we were treating this patient. He had all the signs of chronic CME with drill and everything. So this is a resolution post dexamethasone intravitreal implant at 2 months. The fovea came back with this single owl eye sort of feature here, which you could see here. This recurred again at 4 months, and then we again injected dexamethasone implant because he had already been lasered well enough, and he had received anti-VEGF. His vision improved to 618 at 3 months again after treatment. Then there was again delay, and we have faced those cases where there's a COVID lockdown and the patient doesn't follow up, and he came back with this severe edema here. And with the post-COVID effect, he had an IOP of 40, so there was no question of giving him Ozurdex, and he had this chronic CME, and his vision had gone down to 4 meters in this only eye which he was seeing. So we decided to give him Brolucizumab, and this is the post-resolution of Brolucizumab. At 30 days, he recovered his vision to 6/60. This is the second case. I'll just share with you 2 more cases. Just give me indulgence for 5 minutes, 2 minutes more. So this is basically a 75-year-old Malayali gentleman who was a diabetic for 26 years, pseudophakic, and this is how his eye looked. Both eyes DME. So we gave him Ozurdex implant. So the right eye didn't respond well and the left eye responded very well. We switched to Brolucizumab because as he was traveling out of country, so we suggested that we'll switch to Brolucizumab after doing the Ozurdex and laser. And this is the response we got at 20 days. The left eye resolved completely and the right eye also is showing resolution. So the advantage is he's coming back after 3 months, so we can have a prolonged effect of this drug in his eye. This is the last patient who was a 60-year-old DME patient with PDR glaucoma. We had done ranibizumab laser, then we did a bevacizumab switch. So this is how it went on. You can see this case. Both eyes he had DME, which responded to ranibizumab laser. His vision also improved to 618. The left eye was the one which was resistant. Yeah.
No screen is